Good morning, everybody. It's great to be in Stockholm. It's great to be at the Digital Health Days. My name is Geert Reyniers. It's actually quite funny this morning when I came up to the stage here. Several people came to me and asking me, how exactly do you pronounce your name? Because it's a Flemish name. I'm from the Dutch-speaking part of Belgium. So I have already a Spanish, an English, a French version, so a Swedish version that I just heard was actually perfect. So well done. My name is Geert Reyniers. As I said, I'm here to talk a little bit on behalf of Abbvie, presenting you what we are as a company, but more importantly, bridging between this morning session and the interesting panel discussion and the next speakers after me coming in this session here. What I would like to do is, whereas the other speakers will talk about big data, analytical tools that are required in order to get the necessary insights out of these data, new partnerships that the healthcare world needs to foster in order to be ready for the future. I would like to spend another 10-15 minutes on what we believe as a company still matters the most, and that's the patient. And when I say the patient, I'm talking about the digital empowerment of the patient and how the digital environment will allow the patient to be empowered and how ultimately that will lead to better outcomes and to a more sustainable healthcare, because that's ultimately what we believe it is all about. Let me first of all introduce you, and I'm pushing on the next button here, a little bit more about our company Abbvie. Because some of you may know it, some of you may not know our company. I would say that Abbvie is a little bit of a special company. We're not just coming from the mold of big pharma, as we are sometimes called. We are actually a new company. Our company was founded in 2013, 1st of January, as of the result of a separation from another healthcare company called Abbvie, and through some other events that happened, including some acquisitions in the meanwhile, which actually means that we are a new company. We are headquartered in Chicago. We have a regional headquarter in Paris, where I work. We have about 25,000 employees worldwide. And what is actually very interesting to know for you here in this European setting is that almost a third of these employees actually work in Europe. So the footprint of Europe in our company is very important. And that is interesting to know. We are focused on research in immunology, neuroscience, which is Parkinson's disease, rheumatoid arthritis, virology with HIV and hepatitis C, oncology, kidney disease, women's health, and this is the focus of our activities today. What is important here to know is that because we are a young company, we actually have had the unique opportunity to think about what we want to be as a company. We have had the unique opportunity to look to the healthcare world through a fresh pair of eyes, thinking of what it is that our mission of our company is moving forward. And that is actually very much illustrated by our core values of our company. Anyone in our company has three core values that are in the middle of everything we do. First of all, we want to be patient-centric in our approach. We want to innovate where we can, and ultimately both serve the ultimate purpose, which is creating sustainable healthcare systems. So let me briefly expand a little bit on that, and before we move on. First of all, patient-centric approach. As the speakers of this morning already said, this is about not doing things for the patients, it's about doing things with the patients. It's about making sure that any treatment that we offer as a biopharmaceutical company is more than just offering a drug. It's about offering a solution. And the techniques that you saw this morning about patient journeys, for example, is one of the things that are the heart of what we are doing. Now, innovation everywhere is a broad statement, but the brave new world of digital is a perfect example of how that can be achieved. The services that we want to put in place often are digitally enabled services because digital allows to do things that were never possible before, and I will elaborate on that a little bit further. But most important, it's all about sustainable healthcare. It's about increasing the outcomes of the patients, it's increasing the efficiency of the treatment, it's about making sure that the outcome is better so that actually the healthcare systems and the world we live in is more sustainable as we move forward. Now, why are we saying it like this? And we had some sessions this morning discussing about why is empowering patients, for example, so important here. And this is how I would like to picture it for you. Well, there's many statistics out there, but one of them is, for example, that by 2050, the average age in Europe will have increased to 82 years. But on average, every person will have at least one chronic disease to live with, one way or the other. Which actually means that if you think moving forward that and look at the cost of healthcare, that more patients will require more treatments for a longer period. But at the same time, the healthcare resources are pretty much the same. So you will have relatively the same amount of doctors, the same amount of companies, the same amount of healthcare providers doing the same work for more patients, for longer periods of time. And that, of course, is a clash that we see, and this is the healthcare debate that is on the table for most of us. And this is why the topic of sustainable healthcare comes in, where we have to come up with doing healthcare in a different way so that it becomes and remains sustainable for the future. So we believe that if we harness digital solutions, which is basically something that came up over the last 5 to 10 years, we can do things in a very different way. We can collect data, we can analyze data, we can bring in new technologies and techniques that allow actually to empower the patient in a better way. Because we believe that empowered patients who have control to a certain extent over their own health are also more motivated patients. That ultimately, that will lead to better outcomes. Now, digital allows, and this is very important also, to come up with personalized solutions. When we say digital, it's not about building a website. That is actually just a digital version of a paper document. Digital for us means individual data, means analyzing data, means giving feedback, and what is now called closing the loop is therefore very important, because the data are not just there for the data. It is to interpret those data, have analytical tools in place, and make sure that you learn continuously by closing the loop and improving the service for that individual person. Now, if you do that right, as personalized solutions, because they are personalized, the resources we need to put in place can also be more targeted. You don't need to develop something that is a one-size-fits-all. You can be very specific in your targeting. And we believe, and we experience actually, that that is a cost-effective way of getting solutions out there for patients. And because that is a cost-effective way to get personalized solutions to empowering patients, we also see increasing evidence of improved outcomes. The treatments are better. Patients are cured, patients have better prevention, and patients have better follow-up if we do it in this way. And that ultimately is what we believe the foundation for sustainable healthcare, the healthcare mechanism of the future. We're not there yet, but we think what is going on in congresses like these is actually at the foundation of this thinking as we move forward into the future. Now, how should we facilitate patient empowerment through digital? And I'm trying to picture this a little bit from our industry perspective, and I'm conscious of the fact that there are more players around there that I should have mentioned. But today, and I'm talking Europe, the traditional model of care is one where the patient has a relatively unidirectional interaction with a healthcare provider, where the patient has to make sure that his healthcare services are funded through his contracts or insurance with the payer, and where basically payers and healthcare providers work together, making sure that in the interest of the patients, both the medical side and the financial side for the patient are handled properly. And the pharma industry is sort of on the periphery of all of that, I would say. As an industry, we do have interactions with payers, with authorities, with politicians. We do have interactions with healthcare providers, but it's sort of at the outskirts of that triangle of care. So what we would like to do, and where we see ourselves, as an industry, is one step further. We'd like to put ourselves into the triangle of care. We'd like to have, and we will, and we have, the same discussions with the payer, as you can see, which are not unidirectional, but in two ways. We have the same relations with healthcare providers. Healthcare providers still talk to patients, but there is a patient in the middle. And it is through the interactions of all three components there, with the patient in the middle, that we really believe that we can offer not just treatment of a patient, but care of a patient, solutions for a patient. But the prerequisite of this is that all the three players outside need to work together. Today, I have not really seen great evidence that when payers alone start developing things, it works. When healthcare providers alone start developing solutions, it works. When pharma companies alone start developing things, it works. We believe that it is in the collaboration of the players around the patient, with the patient in the middle, that we will ultimately be successful through digital means in making sure that the patient outcome and sustainable healthcare is guaranteed. Now, the way we do this as a company is through, for example, techniques like the patient journey. And we saw this morning a beautiful example of a patient journey where, and I'm just in a schematic way representing some steps of what ultimately is, as you saw, a more complex journey model. But we try to map what it is to be a patient. And we use exactly the same techniques as the company of this morning show to you, where we go into the skin of the patient, we live the patient journey when he visits his family, healthcare providers, hospitals, and so on and so on. But we want to make sure that we pay attention to two things when we do this. First of all, there is a transactional component in a patient journey. With a transactional component, I mean the patient goes to see a visit, he needs to fill in a physician, he needs to fill in a document, he gets a referral letter to a hospital, he gets a prescription, he needs to get to the pharmacy. That's the transactional component of a patient journey. For each of these steps in the patient journey, there is an emotional component that should be mapped out and that we should understand as digital providers of solutions very well. Because at each stage of that patient journey, I think it is our role to think about what is the optimal patient experience that patient wants or needs. And you can imagine that the patient experience that we want at the stage of diagnosis of a certain disease is very different than the patient experience when he gets his first treatment, and is very different when he is cured and needs to be followed up afterwards. And thinking about which specialists at the payer side, at the ICT side, at the company side, at the healthcare practitioner side, about what that optimal patient experience is across the board is something that I think we should all learn. And we all have our specific expertise in that domain as we move forward. And I'm giving you some small examples of the many things we have done so far, piloting and testing in that field of patient journey and coming with insights and then ultimately with solutions. One of them we did, for example, is we developed an online tool for patients with ankylosing spondylitis. That's a very long name. Basically, it is with patients that have an arthritic disease where the spine is actually not really straight, and that obviously has causes a lot of suffering. For example, with the Royal Hospital of Rheumatoid Arthritis in Bath in the UK, we developed an online tool where patients can actually report their symptoms when they want on an online tool, because we noticed when they go to see the physician, if they are in a good state, if you have a good day, then actually the physician cannot actually do a diagnosis. And through putting that online tool there, actually the patients could register their systems, and then when the visit to the physician came on, then the physician could log in and see actually what the experience was of the patient over the past period. Another example is, for example, in the field of rheumatoid arthritis. We had a little bit of a discussion on this morning on the importance of adherence. We offer, for example, similar programs where patients are reminded through digital-enabled social media, through SMSs and so on, that it is about time to pick up their medication at the pharmacy and actually take their treatment as needed. And that is a very important driver for the efficacy of healthcare as we move forward. Another program that we actually have developed here in Sweden, together with Karolinska Institute, is a telehealthcare program for patients with Parkinson's. We're talking about Parkinson's disease, not first-line treatment, but a treatment after when let's say the first-line treatment doesn't really work. And in order to have that really effective drug for you, you need to wear a pump as a patient, because the drug is delivered through a vein in your stomach that actually delivers the drug in your duodenum. Now, if you are eligible for that medication, for example, as a patient, traditionally, also in Sweden, you had to come to the hospital for 10-14 days, spend 10-14 days in the hospital, because the dosing of the drug is very critical, and it was the physician who frequently interacted with you, checked with you, do you have side effects, you had to do some tests on whether you were shaking or not shaking. And that was a very labor-intensive and costly way of titrating the drug for that particular individual patient. And the system that was up together with Karolinska here and our colleagues here in Sweden was actually through the facilitation of a nurse. We put in place a kind of a video conference program where at the appropriate intervals the physician, through video conferencing, had interactions with the patient, could do some testing with his arms and with his limbs, shaking, not shaking, whatever was appropriate, and then could decide to go higher or lower with that particular dose moving forward. Had the advantage that the patient stayed at home, the cost to the healthcare society is decreased, and actually what we saw is that because of that, the efficiency of the drug and the treatment was definitely increased. I'm also, for example, showing you, or actually proud to announce to you, a new collaboration here in Sweden between our company, TeliaSonera, and healthcare practitioners in the field of irritable bowel disease, a kind of Crohn's disease type of drug treatment disease. Basically, what is it? And I'll do this a little bit faster here. The same thing with irritable bowel disease. If you have that disease as a patient, you need to make sure that you register your symptoms. How is the drug working? How do you feel? That is a quite complex medical description that you need to follow there. Now, what we did is we worked together with a group of 6 university hospitals. They call themselves the IBD 2020 group, and a partner in the technology side, which is your main provider, TeliaSonera, of communication services. And together we put in place a kind of a wireless home care box where the patient could put in his symptoms in a digital tool through a secured line. Securization and the technology side is owned by TeliaSonera. We brought in our competence and our understanding and our partnerships and our project management in this project, and the group of 6 university hospitals with the physicians in place were able not just to look at the data online, live, whenever they wanted, but also can look back to the patient when that is necessary. We did the pilot of this recently, and we are really happy to have our first patients included in a couple of weeks from now as we move on. Last but not least, if this next thing is willing to work. No. Then I'm just going to talk without a slide. Last but not least, companies like ours should not be doing this in isolation alone. We believe that it is only through the interaction with the different players that we can actually come up with these kind of solutions that benefit to healthcare altogether. We are therefore also leading at the European level an initiative called the Initiative for Sustainable Healthcare in Brussels, where at the European level, with different players involved, we are actually working on a European white paper on the particular topic of sustainable healthcare. And I would really like to invite you to Google a little bit and go further and look at what this is. But what this group at the European level has already come up with is that they have identified 3 key elements to make sure that sustainable healthcare for the future is there. That is patient empowerment, reorganization of the delivery of care, and prevention. And guess what? The digital component and the importance of digital in realizing those 3 European initiatives around sustainable healthcare is going to be fundamental to the success. So last but not least, I'm looking forward to hearing about the next speakers on how that sustainable healthcare model can be achieved, the role of the players individually, and how, most importantly, we can work together, because alone we cannot do this. Thank you very much for your attention.
Thank you, Geert. Thank you very much.
Thank you.
And thank you for being one of the main sponsors of the...
My pleasure.
Of course. Twitter feed, getting questions here on Twitter as well. One question just, I mean, you're an international company, so you see the whole world as well. Yeah. Do you see any sort of, the question is, are there any statistics that rank empowered patients per country? I mean, but could you just give us a brief outline of where is it happening in the world? Do you see any hotspots?
Well, today, I don't have any statistics as such that I can say if Sweden is ranking so much versus other affiliates. But there is definitely more than anecdotal evidence around there that empowered patients that are contributing themselves actively to their health, are actually generating outcomes clinically that are better. That evidence is overwhelming. There are a couple of mega studies going on for which I haven't seen the results yet, but it is definitely an area that I think we should not even have the discussion anymore about. That is for the obvious. It is also clear that the more digitally technologized countries, so to speak, United States, Canada, and Western Europe are leading the way there. And I do believe that in Europe, there is a little bit of, you look where the internet is north, there is a gradient from north to south. So the more you go to the north in Europe, the more digitally enabled the normal population is, and so the more digitally enabled patients are. And I think that with the initiative that I just showed, that Sweden, among the other Nordic affiliates, is definitely leading up front in that particular movement.
Thank you very much, Geert.
You're most welcome.